So about myself, I am originally from Michigan, did my undergraduate at Michigan State, went to medical school in Chicago College of Osteopathic Medicine. After that, matched in my residency of family medicine at Metro Health downtown on West 25th. Once I graduated, I did 1 year of urgent care, and now here I am in primary care. When people are struggling with mental health issues, that often dominates what they experience every day. So a lot of times we find that it's very common to neglect physical health, and so it's very important. These two things are tied together very closely: mental health and physical health. So physical health can be ignored when people struggle with mental health issues. We do see a lot of that, when addiction is prominent in somebody's life, chemical dependency on alcohol, and in the news lately, all this heroin addiction and opiates, and that oftentimes will trump everything in people's lives, and so physical health becomes the last thing on their mind essentially when it comes to their health. First and foremost, we get to know the person, what their background is, where they're from. It's good to learn about the person that you're seeing, that you're going to be establishing a relationship with, and then we get into what's your history, do you live with anybody, what's your past surgical history, those types of things, and then we get into what the person coming in for is, what are they concerned about with their physical health or mental health, whatever they want to discuss. And then I'll have some things I'd like to bring up. Sometimes we get blood work on people just to make sure there's screen for diabetes, screen for hypertension, check for cholesterol issues, these common primary care things that we see often. We definitely will take the person's history into account, and if they're at risk for things like hepatitis, HIV, those things, we will often recommend screening, and we can do that right there in the office. There's also rapid screening tests that we can do for hepatitis and HIV as well. That is definitely a service we offer. I try to tell people that we're not scary. So there are things that may seem not a big deal when patients have certain symptoms or concerns with their physical health, and they say, worry about later. But sometimes it is important. I think there is that fear, but we do our best to figure out what's going on, hear the person out, our patients, and try to find the best treatments if there is something to be done, whatever they're coming in with. I'm an osteopathic physician, so part of what we learn as osteopathic doctors is that the mind, body, and spirit are all connected. So it's challenging to have good mental health and good physical health if one is lacking. So if somebody is struggling with mental health or addiction, it's difficult to maintain good physical health as well. There's plenty of studies that have been done that show how connected the mind and body are. So basically, a comprehensive approach to taking care of our patients is really very important to really treating our patients to the best of our ability. So we have mental health and primary care at the same place. The psychiatrists, the psychologists, counselors are right down the hall from primary care. So people can get their comprehensive mind and body care in one place. We're not scary people, so we just want to help people, live their best lives and try to treat the conditions they have and try to prevent disease from occurring in the first place as well. Prevention is the hallmark of primary care. That is the key thing that we try to do, because most of what people suffer from in our country is preventative diseases. So things like cancer, heart disease, those are the two leading causes of death in the United States. Heart disease and cancer, very preventable in a lot of cases. A lot of what we do is trying to prevent diseases from occurring in the first place. Diabetes, all these things are often lifestyle dependent. So what we eat, how much we exercise or how little we exercise, it's the key to primary care. And so part of what we emphasize in our clinics here at Signature is that we try to do our best to prevent people from getting sick in the first place. It saves people money. It allows for them to live their best quality life as possible before all the serious things happen from a neglected chronic disease. So right now we offer primary care at Maple Heights, Willoughby, Beechwood, Ashtabula, and Paynesville. Generally, we see walk-in patients as quickly as we can. So oftentimes, our schedules do have some room to play with to get people in who have more urgent issues. Those are generally quicker visits, so we can see, do you have strep throat, do you have the flu, those types of things. We do our best to try to squeeze people in same day. For primary care, we have evening hours, at least 1 day a week at most of our locations through 7 p.m. And then we start usually at 9 o'clock every day. We do have a pharmacy on site, and there are financial advantages for using our pharmacy, especially if there's no insurance insurance. We're a federally qualified health center, meaning that we do get federal money essentially to help patients who are underserved without insurance and on public insurance. And then we also offer transportation assistance as well. We've partnered with Lyft to help people get rides to and from appointments if they aren't able to. The culture here at Signature is that we're here to help, and we're also here to prevent disease. We're also here to take care of the person that comes through the door as a whole person. So we look at, what is their financial situation? What is your mental health situation? Addictions issues, family issues. So we try to address all these things and take care of our patients, keeping all those things in mind. We know that in order for people to live their best quality life that they can live, the mental health, the addiction issues, the physical health are all tied in. So we don't want people to be afraid to come make an appointment, discuss what's been on your mind or what you've been wanting to discuss with a provider. And then hopefully that starts the process of really getting into anything else that needs to be addressed. Generally, we do yearly or every 6-month follow-ups, but if there's a condition like diabetes, which requires more closer monitoring, or hypertension, high blood pressure, closer follow-up, frequent blood pressure checks, then we would do sooner follow-ups. So the other advantage, we also have a wellness nurse and we have a nutritionist as well at our locations. And what they do is they help facilitate more of the lifestyle changes that would help prevent disease and help keep diabetes, hypertension, cholesterol, obesity, these things under control. It's another service that we offer as well. At Signature, we will take care of anybody from infancy all the way up through geriatrics, so people can bring their families in. We offer vaccines for children and adults, school physicals, that type of thing, sports physicals, so any time a patient needs any of those services, we have that as well. At Signature, we pride ourselves in taking care of patients who are on public insurance, so Medicare, Medicaid, and also people without insurance. It's really important because there's a gap in care for people without insurance, and they often avoid doctors for cost reasons. But our philosophy is, we try to take care of everybody that walks through the door, so regardless of your ability to pay. And we do have people that work at Signature that help people apply for Medicaid. We don't want to leave anybody out who is looking for help, essentially. So when you need help now, Signature is here for you.